This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
All right, before we get into today's show, I need to ask, have you registered yet for the Real Talk Pond Hockey Classic? It's coming up on Saturday, February 3rd, out at Larry Alexiak Field in St. Albert. It's going to be our return to that venue, an absolutely fantastic one. If you're watching on YouTube, I'm showing you on my screen right now the highlights from last year's Real Talk Pond Hockey Classic, and I'll post the link to this in the show notes so you can check out what we're talking about. This isn't your average pond hockey tournament, friends. It's an absolute blast. 24 teams of 4 to 6 skaters all out there for a great cause. We have our charities of choice, including uncles and aunts at large and kids sport. We want to remove financial barriers to kids playing sports, and so that's why we're so proud to partner with them. It's a day of beers and burgers and bonfires, and it's guaranteed to sell out, so we want to make sure that you don't miss it. It's the Real Talk Pond Hockey Classic. Nobody does it better than our organizing committee. I mean, we have freaking Zambonis. It's going to sell out. Johnny Infamous is going to be spinning the tunes there.
I can't wait.
It's such a fun day.
Oh, it's always such a great day. And I'm guessing the weather isn't going to be too bad this year.
We're knocking on wood,
considering
man.
what's going on. But the ice will
know.
be fresh. The food trucks will be out. The beers will be
St.
flowing.
Albert does an amazing job for us, getting that ice surface ready to ice surface.
Big thanks to them, actually.
Huge thanks to them. This project, back in the day, the Pond Hockey Classic, we used to do it on ponds, as the name would suggest, but you'd get you'd get weather situations that weren't favorable. Either it was too warm, and the city of St. Albert couldn't, in good conscience, send us out there on the ice, or it would be so cold that the ice would be brittle and just nasty, and it just wouldn't work out great. Now we flood a field. We have our own custom venue, and it's just an amazing, amazing day. So you go to ryanjesperson.com, you click on the events link, and then you go to Pond Hockey, or you can just go to ryanjesperson.com/pond-hockey, and you'll find the registration link there. It's in partnership with the Canadian Progress Club. They've raised almost $1.5 million for their charities of choice over the years, and we're really proud to partner with them. So that's the Real Talk Pond Hockey Classic, again, coming up on Saturday, February 3rd. Let's get right to it. We're talking today about your health. We're talking about the health of the province of Alberta, our home province, and we're going to talk about the health of the system as well. And in just a quick second, we'll talk to the president of the Alberta Medical Association. We're going to talk to an executive VP with the Alberta Dental Association as well today. A big announcement by the feds. As you know, a new dental care plan. Who's it for? Who's it not for? Who can go ahead and get rid of their insurance? And who better not quite yet? We're going to get to all of these answers. We'll talk about naturopaths today. We'll talk about nurse practitioners. We'll talk about acute care. Basically, what I'm saying is that we're going to be talking about something of relevance to every single one of you, whether it's you or whether it's someone that you care about. Today's issue will be relevant. And the issue is presented, this whole episode is presented by our friends at Business Career College. They know that this is the time of year where people are going to start thinking about what's next. That's the way that we're wired as human beings. We get ready to flip over the calendar to a new year, to 2024. And a lot of people are going to start thinking about new careers, maybe more rewarding careers, higher paying careers. But some of you are going, but I don't have a university degree. We've got the solution for you. You can get started as an insurance professional with Business Career College. In Canada, insurance agents are making great salaries, starting at, 55, 60 grand a year, soon rising up to 90 or even 6 figures annually. And all you need to do is take an approved course and pass your licensing exam. Business Career College offers industry-leading approved courses in life insurance, property and casualty insurance. Plus, their expert instructors are passionate about getting you started, helping you launch. And right now, there's a great opportunity for you because you heard about this on Real Talk. You can save 15% off any insurance course at Business Career College with the code REALTALK. That's all one word, the promo code REALTALK. Get started today at businesscareercollege.com. Dr. Paul Parks is the president of the Alberta Medical Association, and when you're interviewing someone like Dr. Paul, you're going to find him in a different part of the province, in part because he's just wrapped up a province-wide tour. He's going around, he's talking to his colleagues, he's getting a sense of not just what the issues are. Those are apparent and obvious to anybody that's working in healthcare, but how some issues are specifically impacting certain communities, certain demographics. He's the president of the AMA, and he joins us live on the show this morning. Welcome back. It's nice to see your face.
Yeah, good to be here. Thanks for having me.
Yeah, you bet. So you've just wrapped up this province-wide tour. Did I sum up your mandate, or did I miss anything? How did it all go?
No, you got it. We're going around. I mean, it was to engage with members. We were going into clinics, into hospitals, into communities, but basically also engage with any healthcare stakeholders. So we're meeting with municipalities, with government, you name it. The big piece was to get the lay of the land. And I think we had a sense it's bad in a lot of places, but trying to get kind of an idea of that big high priority. What are some of the key issues that resonate across the province that we need to tackle, and then how do we deal with some of the local issues?
So, do you return from a mission like this feeling encouraged and inspired, or do you return feeling quite the opposite, depressed and overwhelmed?
I don't know. I don't know if I'm broadcast here now, if it's video or not, but I've noticed that I got a lot of gray in my beard. I don't think I had any two months ago, man. I'll tell you, it's tough because, I want to be hopeful. I think you go around and you see the amazing work our teams are doing. I should give that shout out first. Is literally we are, unbelievable care that can be given if you get into the system, and the teams are working crazy hard and they're doing an amazing job. But I'll tell you that, it's challenging. The system's really struggling, and there are a lot of major issues, and we got to really roll up our sleeves and work with the government. The Minister of Health is getting and understanding the issues, but we got to get the Premier to understand it, and we just got to really get some immediate stabilization. It's tough out there. So I'm hopeful and I'm optimistic we can make an impact, and I'm thankful for all the amazing work our healthcare workers are doing, but it's a tough situation out there.
I'm always curious to ask people, how would you describe your relationship with the province? Like you met with the health minister, I think it was a couple of weeks ago. Was it positive? You say we got to get the Premier's attention, we got to get our issues on her radar. Do you feel like she's receptive to it? Is it a good back and forth?
Well, yeah, I think I have a very good direct relationship with the minister, and I think we've got some good proposals going that are, that some really good suggestions around how are we going to stabilize family medicine, how are we going to do some immediate stabilization in the hospitals. But some of that's going to take, some creative solutions and some upfront investment and money, and that's kind of why I think now it's critical that we get the entire government to understand too. And I know the minister will be communicating directly and raising these issues up high too. But it's just that I don't think in 20 odd years, I'm positive in 20 years, and talking to my colleagues who've been working longer, that the system is really struggling and it's never been this bad. So we just really need to inject some immediate action.
We had an interesting conversation yesterday. We have through this week about the health minister and who she's been talking to. And I want to talk to you about nurse practitioners. We did a Real Talk roundtable on that. I know that family docs, and maybe not everyone feels the same, but generally speaking, there's some concerns about some of those changes. But let me ask you specifically about the health minister tweeting a photo of her meeting with the president of the Alberta College of Naturopaths. Some people go, well, don't worry about it. That's not something that we want to, whatever, people can use naturopaths. Other people are going, this is preposterous. This is totally ridiculous. Some people feel like that's not at all who the health minister should be talking to. What's the position of Alberta's doctors? What's the position of the AMA?
Yeah, so, to be very clear, the position of the AMA and physicians are we're evidence-based. We're scientists. So, where the evidence shows that this is, that care can be helpful and impactful, and you can get actual meaningful, good outcomes with the energy and money that's being spent, then you follow the evidence. Absolutely have a balanced and evidence-based approach. I'll tell you, we're in a situation where I understand there's no question we should be all hands on deck. All healthcare providers that play a role that is evidence-based, we should be increasing that. We should get more nurses. We should get more nurse practitioners, more physician assistants. There's roles for physiotherapy and chiropractors and respiratory therapists. And there is definitely clear scopes of practice and clear areas where we know the evidence supports it. that's the position from the AMA and from physicians is let's put our efforts and our priorities into the evidence-based areas that we know will work and make an impact. And so I'll just tell you that the minister is meeting with ourselves as well, and I think she's willing to meet with anybody that might be able to help. But I keep kind of pushing strongly and advising, saying, listen, you got thousands of family doctors, for example, that are struggling to have their practices be viable, and we've got solutions for you that will help them. Let's put the focus there. Let's look where we know you'll get the biggest bang for your buck and the biggest impact for Alberta.
Like in layperson's terms, is the concern that the government's getting distracted?
I worry that one of the things I will say for sure is that every announcement of all of these other small little areas that may or may not help takes away attention and time to talk about the big areas that we know are critical and truly on fire, that we know we could fix, like primary care, like our acute care hospital systems now. I mean, we should be spending all of our energy right up front on stabilizing the medical acute healthcare system and the primary care system that we know works and has worked for hundreds and hundreds of years. That's where our attention needs to be. And that's why I say I think now we need all hands on deck. We need the government. The minister is working with us, but we need the premier to get this. We need to say, let's do this. Let's make something happen and stabilize things.
Okay, so let's establish what happens if nothing happens. In other words, what happens if we don't fix this? What are we talking about? We had a conversation here on the show since you and I last spoke with Dr. Bradley Martin. He's a dedicated and remarkable family doc. He hasn't even hit his 40th birthday yet. In Hinton, he was specifically drawn to rural health care. The guy is a salt-of-the-earth type person. He's the exact type person you want working in healthcare. He's actually stepping away from his family practice. He'll still have clinical duties, but he's stepping away from his family practice for his own family's health, for his own mental health. People should listen to our interview with him. It's remarkable. That's one example where you might say that person's stress or experience is leading to that person leaving, but I suspect he might be the face of a whole lot of people.
Oh, absolutely. I'm hearing hundreds of those stories now. So I'm just going to be as blunt as I can be. If we don't get immediate action, right now, all of the things we're putting in front of the minister and trying to get in front of the premier is saying, listen, we need to sustain what we have right now. We need to stop the bleeding. Anybody out there that's ever seen a TV show with a trauma, the very first thing you have to do is stop the bleeding. We have major arteries bleeding right now, Ryan. We need to stop the bleeding and stabilize our family medicine clinics, for example. So that example you gave, I've gone across the province and hearing hundreds of them where they just literally can't maintain their practices and keep them viable because of an antiquated funding model. And it would take some significant investment upfront. We've given a plan, we've given ideas. Other provinces have done this. BC's done it, Manitoba's done it, Nova Scotia's done it. They've prioritized and said, listen, we're going to stabilize what we've got, stop the bleeding, just get some stability, and then create an environment where we can then recruit and get more people in. But I'll tell you, to circle back, we're just going to get more and more Albertans not have access to primary care. And then on the acute care side, we're going to have a situation where people will die if we don't improve our access and work on this right away. I'm not pulling my punches anymore. We already know of really bad outcomes, and more people will die. That's what's at stake. So that's why I'm really kind of pushing as hard as I possibly can.
We're talking to Dr. Paul Parks, president of the Alberta Medical Association. By the way, Dr. Bradley Martin joined us on November 14th for anybody that's looking for that episode. On November 30th, we hosted a Real Talk Roundtable, and the thumbnail on YouTube, the title of the episode was "Can Nurse Practitioners Heal Healthcare?" And we had an interesting conversation with the president of Athabasca University, with a nurse practitioner and an instructor there, and then a recent graduate, about some of the ways that they think that NPs could ease some of the strains on the healthcare system, including access to family docs. The province seems wide open to the idea, encouraging nurse practitioners to open their own clinics. There has been some pushback, obviously, from family docs. Can you take us into your and the AMA's perspective on this, where you think they might be able to help, maybe why you have some of your concerns?
So just to be really clear again, I'll echo all hands on deck. So nurse practitioners have an amazing role, an integral role that can play in primary care. So we want more nurse practitioners. We want them well funded, and we want them to be able to do their full scope of practice. But again, it's just saying it plainly, and we need our minister and the premier to say this too. They'll never replace family physicians. And other jurisdictions have tried to do this where they've tried to fully replace and have them work independently. It's cost more, utilization's gone up. There's been lots of issues. So why would we try that again? But absolutely bringing more of them in and integrating them into our practices that exist now and connecting them with family medicine specialists, so that then in a team that might see 1,000 patients can now all of a sudden see 1,500 or 2,000 patients and get more Albertans access. 100% we support that. But I'll say it again, they will not replace family medicine specialists. It's very different training. And the other part, I'm talking to nurse practitioners out there. I've met with them. There just simply are not hundreds and hundreds of nurse practitioners out there just sitting in the wings. You're talking about your pond hockey. They're not on the bench just waiting to come out onto the ice here. They're working right now. They're doing care. They're doing amazing things in teams. So getting more of them is awesome, but just creating this plan that we're going to shuffle the deck chairs on the Titanic, that won't help Albertans. We need to be strategic in this. So long answer is I'm not against, and the AMA is not against nurse practitioners in any way, and they'll play an integral role if they're integrated and connected and we have more of them. But again, the focus should be on the thousands of family physicians we have that we know can do a full scope practice and support them and build the teams around them.
Had an interesting conversation yesterday with the co-host of The Discourse. It's an Alberta politics podcast. You got Cheryl Oates. She was the communications director for Premier Rachel Notley at the time. And then Erica Baruti's founding president of the UCP, and she was principal secretary for Premier Danielle Smith. So they've both been in Premier's offices. They both know how it operates. But, they're talking like politics and policy. You're talking, pragmatism, frontline, in practice type stuff. So I wanted to run something by you, Dr. Parks. This was Erica Baruti's yesterday, talking about in the general context of nurse practitioners, but the bigger picture, trying to solve the family doctor shortage, trying to make it easier for people to see a healthcare professional right away. And she mused about taking the dentistry model. In other words, like the hygienist sees you first, and if necessary, the dentist sees you, but the dentist might not see you. Anyway, here's what Erica had to say.
I would love if we all started to look at it as the primary point of care. And I think that's what you're seeing the government talking more about, as opposed to just family doctors. Now, not discrediting the need to address family docs, but if you can also look at it as point of care, and we've seen that with nurse practitioners being able to run clinics, from getting people in the doors and seeing a health expert that can support them. I think the dentistry model is actually interesting. That could be something that physicians start to explore, on having the doctor come in when needed, like your dentist does, and you deal with a dental assistant and a dental hygienist until that scope is extended.
So that was Erica Baruti's. What would you say to that?
It's a great analogy, Ryan. Let me put that plain for you. How many dental hygienists and assistants work completely independent in an office that's not connected to a dentist? If you had a serious toothache and really bad pain and swelling and infection, would you be happy to go to a clinic that just had a hygienist that could just give cleaning to your teeth and not connect you to the dentist to take care of that abscess and the severe pain you're having? No, that's not the model that exists for dentistry. They're connected. They are integrated. They work together. 100% we have already existing models where nurse practitioners will do all of the care for a patient in a clinic. And sometimes they don't even have to discuss that with the family physician because it's fully within their scope. But when they run into something that's more serious, like chest pain, and is this the heart, or is this indigestion, or certain things, I'm just throwing examples out there, they can then hand that over to the physician, the expert, the specialist. So that's a great analogy. Albertans have to understand, we're not saying, no, we don't want a whole bunch of dental hygienists and dental assistants. We're actually saying we need way more of them for the dentist. But they need to be connected to the dentist. So just switch all those words to family physicians and primary care, and it's pretty clear what our position is.
Paul, your team does a great job, I think, on the information side. People can check out the website, albertadoctors.org. We'll link to it. There's an interesting, on November 29th, you released a post, Stabilization on the Table, 3 things you need to do. And I find that a lot of times one of the roles that this show has, the public knows that there's a problem. We know that there's problems in healthcare. We know that there's problems, for example, with the Alberta Energy Regulator. Don't worry, I'm not going to drag you into that. We know there's lots of problems with a lot of things. But then when you start talking about solutions, everybody's not crystal clear on what the solutions are. So you've kind of laid this out, saying to the province, like, here's at least 3 quick things that we could do right away that would really help. Can we talk about that? Like, just as a couple of people with a few thousand people listening, just so people get a better idea of what we're talking about, what the ask is really?
Yeah. So, I mean, and then we're doing the same ask on the acute care side too in the hospitals, but just for family physicians, for example, we're just making it very clear right now that the way that the funding model was before, there were some changes pre-pandemic, the government fighting with us, they made a bunch of cuts that just changed comprehensive, complex care for family medicine. And so we need to actually invest some money to stabilize that back so we can just keep our practices viable so they can keep the lights on. So we told the government what that would look like so they could just pay their rent, pay their staff, and keep their offices running right now so we don't lose more physicians like the one you mentioned earlier. So stabilization. Then this move to an LFP model, which is, it doesn't matter what we call it, but what it is, it's a funding model that goes away from fee for service, meaning all of the old fashioned way of how we pay doctors forever is you, Ryan, have to be sitting across the table from me. I have to see the whites of your eyes and you have to be in front of the doctor for every encounter. That's why it drives Albertans crazy that the docs are like, listen, if you got 3 problems, you got to come for 3 visits because the doctor can only get paid for one thing at a time and you have to be in front of the doctor. We have given them a model that other provinces have already adopted that switches so that you can actually just fund and pay around a panel and the complexity of the number of patients you have and the team that's built around you. So, I mean, there's obviously complex details in there, but what we're saying is if we don't evolve how we pay family specialists and how they do the care, all we're ever going to get is that episodic one real quick visit. You got 5 minutes of their time, 10 minutes max, and then you got to keep coming back. That's not what Albertans want, and that's not what will make the practices viable. So we've given that solution. And here, I just want to say it again, BC's done it, Manitoba's done it, Nova Scotia's done it, Saskatchewan's looking at doing it. We do not have the Alberta advantage on family medicine now. We're way behind.
Wow. You've got to chair a meeting, so we've got to let you go. So let me ask you this in closing. We know that hospitals are strained and crunched. You and I will talk again about that. We know that we're entering respiratory virus season. I'm not trying to get you to pick a fight here, but Sylvia and others like Karen, for example, on our live chat, we'll go with her comment. She goes, I want to know where the Chief Medical Officer of Health is, Dr. Mark Joffe. She says hospitals are overflowing with respiratory viruses. Nothing's being said about what we could do to help stop the spread, like masking or getting vaccinated. What's going on?
Yeah, you know what? I want to say I know Dr. Joffe, and he's a good man, and he's an expert in infectious diseases. We should be hearing more from him. No question in my mind. I'm on the front line, so I'm still working in emergency departments. I just came from shifts yesterday. We are seeing unprecedented influenza. It's one of the most severe influenza seasons we've had in a long time, and I think Alberta's vaccination rates on a proven vaccine that's been around for decades for influenza is under 20%. I'm telling you, we're in a full-on respiratory crisis. I would love to hear more from the Chief Medical Officer of Health. I would love for you to ask the Minister and the Premier why he's not out there really advocating for what we can do to make the system better, because we need more information and more transparency and more expert opinion out there for sure.
Thanks for everything you're doing, and thanks to your membership and everybody you represent. Healthcare workers on the front lines, Alberta's doctors. That's Dr. Paul Parks, president of the AMA. We'll talk to you again soon.
Yeah, let's do this again for sure, and let's talk on the acute care side because it's struggling too. So I think people need to understand what we're dealing with. It's a pretty tough times now. So
100%. I'll tell you this, as the doctor has to go, I know he's chairing a meeting starting in 3 minutes. There's a post from December 11th that they have at albertadoctors.org, and we'll link to that specifically in the show notes on YouTube and on the podcast. You're looking for the one with the headline, Acute Care, We Are Acting for You, and you can learn a little bit more about what their advocacy looks like. I mean, they say we're calling for reduced emergency department and surgical wait times. We've got to improve patient flow and outcomes. The hospitals are bursting at the seams, and this stuff isn't hyperbole. Like when you hear him talking and he says if we don't improve this, people aren't going to see doctors. If we don't improve on these things, people are going to die. This is the guy representing like hundreds and hundreds and hundreds of doctors that know. I mean, this isn't one of these sorts of things. We talked to Charles Adler on Monday about alarmism or sensationalism. This isn't that. If you have somebody, this is our family's impacted by this personally right now, a family member of ours who has enormous mobility issues. She's requiring a major hip surgery, and they're paying out of pocket. They're trying to get down to a jurisdiction, probably Mexico. We're going to pay out of pocket to get the work done because they've been quoted a wait time of 18 months to get the surgery that they need. And then we start talking, Johnny, about things like opioid addictions. We start talking about how people are managing their pain. And then we're telling people that need, double knee replacements or hip replacements or whatever else. And I'm just talking about one type of surgery. I mean, there's obviously dozens or hundreds. You're telling people that their wait times are going to be months or even a year and a half. And what are people supposed to do? Mm-hmm. I mean, it's a system, that's pretty striking to hear him say, something that we're all, a lot of people in Alberta very proud of, this Alberta advantage. For him to say we do not have an Alberta advantage in healthcare, that's a wake-up call.
I can't see it getting any worse than it is now. My partner waited 3 months just to get a test done the other week. So, I mean, it's to see it get worse than that, and to think that if you have a problem, you're going to have to wait 6, 7, 8 a year for something. I know what's going to happen. Yeah. We both know what's going to happen. People are going to go down to the States. People are going to go down to people are going to start leaving and getting private health care wherever they can, which is going to cost people.
And then again, people will say, well, it must be nice for people that are rich and they can afford this.
Rich.
A lot of people, they're not rich.
They're dying.
For a lot of people, it's like they are prioritizing this. They're cashing in their RSPs. They're doing whatever they need to do. Yeah. They're not taking that retirement vacation. They're not doing the things that they would have done, because they need to be able to walk.
Yeah.
And man, oh man. Interesting comment here from Sylvia. I wanted to note it. It says, I want to know why there's no pushback from the AMA about the idea of naturopaths being recognized as part of the publicly funded system when there's no science ensuring that their treatments are safe. Mm-hmm. I know that the whole field of naturopathy is very polarizing. A lot of people kind of swear by it and believe in it, and then everybody kind of has like a friend that works there, so nobody wants to say anything. But generally speaking, within the science, like evidence-based medical community, there's not a lot of credence that's put into the field. No offense if you're a naturopath. I'm probably not the first person to tell you that you have your cynics, right? And so when people do see, and there's it's understandable why public opinion, there was pushback when the health minister posted that photo meeting with this guy, with the president of the College of Naturopaths, because people are going, shouldn't we be dedicating all of our time and efforts to like figuring out exactly how we can stop the bleeding on the main stuff that everybody quote unquote believes in, the stuff where we're all on the same page. We all believe, or most of us anyway, that family doctors are capable and competent and trained and evidence-based, and that's where we should diverting our efforts.
We do know some naturopath. We know it's helpful. We know massage. We know acupuncture. We know detoxification can help.
But I wouldn't even give naturopaths the benefit of massage. That's not their field.
Well, that's in the field.
The massage therapists are different, and there is evidence. Naturopaths are. I mean, I have an axe to grind with naturopaths. For example, there's a little boy that and I'm not pinning this on naturopaths. I'm pinning it on his parents. His brutal parents that were tried on this, and I don't even know if we want to bring this back up again, but a little boy that died a horrific death of meningitis at 18 months old in southern Alberta because his parents believed that a so-called prescription of hot mustard,
herbal medicine,
and horseradish was going to fix his meningitis when he was in desperate need of a visit to the ER, the ICU. So I mean, and then people say, well, fuck you, Jesperson. You're discounting and mocking something that's helped me with my thing. Listen, if you have found something that helps you in your journey, that's great. And you don't need to worry about what my opinion of it is. But I get really nervous when someone says, with my cancer care, I'm going to go talk to my naturopath because they have this whole other way of approaching it. I just think, like, to me, that gives me the heebie-jeebies.
Yeah. Well, I think people in that state, they're desperate, and sometimes they'll try anything. And that's where sometimes the snake oil salesman can seem evil and are kind of evil. But I mean, there's different varying degrees, like, eat more garlic, eat more vitamin C. We know that's all good for you.
Yeah.
But you're right. It's not going to stop, harsh things that are happening to your body that need serious medical attention, right?
Yeah,
So,
yeah. Ken is quoting Noam Chomsky in the live chat. Says, I know, like, what a flex. Chomsky still alive and kicking. I saw an interview he did the other. He's like 93 or something like
still
that.
So like. He's so I don't know what the word is. Like
cerebral.
He's just there.
He's on it, man.
He's like dialed in still at his age.
So Ken says, quoting Chomsky, that's the standard technique of privatization. Defund, make sure things don't work. People get angry, and then you hand it over to private capital.
Exactly, yeah.
That from Ken. I appreciate the comment. There are others of you, like I appreciate this one here from Tara Lynn, who says, and Johnny, you know what? I was rude. I kind of interrupted you and was like, don't drag massage into this, and I didn't mean to be rude. You and I, this is how we talk. But Tara Lynn is right, and I think you are right to a certain degree, where she says a healthy relationship between natural health care and scientific medicine is important, but there needs to be accountability.
I just mean that some of that stuff can make you feel better, which is a pathway to health, right? But it's got to be a collective thing where like you're also listening to certified experts and medical professionals. Right?
Totally. I think we're on the same page there. Not that matters, but I do think we are. Like, man, this is great. Dwayne says modern medical technology helps us live longer. He's talking about how relatives who passed away at a young age back in the day, modern medicine didn't exist, and celebrating the advancements that have been made. You look at like life expectancy just a few hundred years ago, life expectancy was like 40.
I was talking about this with someone because we were talking about the mild winter, but like winter used to be the number one cause of death back in the day. Like, can you imagine like all the things we should be thankful now, like indoor plumbing, heating, electricity on demand? Like, do you know how hard it was
we are
in winters
so soft now
to just survive, and the stress it used to put on your body? That's the main reason we all used to die at 40.
Yeah. Justin here says, I don't mind the idea of that sort of dentistry model for nurse practitioners. I thought it was interesting when Erica brought it up yesterday. He says, but I don't think I'd be as comfortable seeing a hygienist that isn't working with a dentist or being overseen by one. That from Justin, interesting point. We are going to check in with the VP of the Alberta Dental Association in just a quick second. Before we do, and this is not an ad, this is not a commercial, this is not a paid mention. This is just something that I personally have been proud to support through the years, and I know that many of you this time of year are looking for a way to, I mean, obviously in your own backyard, there's a lot of nonprofits that are very worthy of the donation dollars that you may have available or that you may make available this time of year. But I wanted to talk to you very quickly about the work of Hope International Development Agency, and you can find them online at hope-international.com. Hope International is working in a bunch of different countries. I mean, over the years, they've helped millions and millions of people literally, in some circumstances, simply survive. You can view their impact report on the work that they've been doing around the world. But get this, they've got more than 1.1 million people participating in dozens of initiatives, 41 projects, over 17 different countries in 2022 on food security and education and health and livelihood and clean water, and the list goes on. So why this time of year, you ask? Well, if you check out their website, gifts.hope-international.com, it'll be in the show notes. You'll find a Christmas gift that you can give, and this is one that's been really neat over the years. We've been proud to do this to friends and family members. They have a giving catalog that really has the power, and it gives you the power to help people lift themselves out of extreme poverty. So your giving means that hope, quite frankly, is going to be more than a Christmas wish for families. It can be in the form of clean water or health support or improved food security, nutrition, education, livelihood training for women. There's amazing entrepreneurial initiatives. So you sign up and you can support a gift. You can also sign up for monthly gifts, which is really neat. But you just follow the instructions. You click through there. You can gift someone like a chicken. You know what I mean? So you gift a family a chicken in a developing nation, and the money that you pay to provide that chicken, they'll also send a card, a Christmas card to somebody you care about. So I might say, for example, send a card to my mom, and it says, hey, Mom, in lieu of a gift this year, we are gifting, or in your name, we are gifting a chicken to a family in country X. And it's a really neat way to support people that you will never meet, but people that are in desperate need of a helping hand this holiday season. I happen to know that in this audience is comprised of thousands of people who understand empathy, who understand generosity, who understand paying it forward. And I just wanted to take a second on today's show to put that on your radar. So again, you can check out the show notes or just go directly to gifts.hope-international.com if you'd like to do more. We'll check in with the vice president of the Alberta Dental Association, a big announcement out of Ottawa. Like we're talking like 9, 10, up to $12 billion over the next number of years for dental coverage for Canadians, households earning less than $90,000 annually, but there's a few things that Alberta's dentists want you to know about and some questions that remain unanswered. So we'll get to that in just a quick second. These conversations are happening with the support of partners of ours like California Closets. They're, of course, known province-wide, Alberta and into Saskatchewan, for custom closets and storage solutions for the entire home. And here's the thing. If you're looking for that perfect gift for your spouse, maybe it's for your parents, I don't know. It could be any type of scenario. They've got everything. They don't need another set of, cufflinks. The last thing they need is another chunky sweater. They sure could use somewhere to store those cufflinks, though. A place to put those sweaters away nice and neat. California Closets is a perfect gift for the holiday season, and you can request a free consultation today at californiaclosets.ca. We've done business with them. They've worked in our home, and we've seen the results. The design is impeccable, and it's an investment that pays off for years and years. We also want to give a big shout out to the family-owned business that is Grand Dog Essentials Quality Raw Food. They've got a great deal for you going this December. If you go to granddog.ca, you can see it on their website. You go under the Shop Now link, and you can see all of these great supplements, all the different products that they have at granddog.ca. They've got a special through the month of December. The December promo, their chicken raw pet food blend, the 40-pound box is on sale for just $84. Now, one of the reasons why this is something we're really working to get the word out on is it's great for dogs and cats. It uses entire whole Alberta-raised chicken sourced from human-grade facilities, which means that the nutritional content here is absolutely excellent, and there's no limit to the amount of boxes that you can get with this deal. So if you want to fill your freezer with chicken raw pet food blend, you can do it by using the promo code December 2023 at checkout at granddog.ca. That's December 2023 at checkout. The website is granddog.ca. This is a big story, and Canadians have been waiting for details on a new dental care plan for a long time. Ever since the federal NDP, led by Jagmeet Singh, made it very clear that if the Trudeau Liberals were going to have the NDP's support to be able to govern, basically, they were going to have to roll out meaningful funded dental care for Canadians. The announcement made on Monday, the CDCP, the Canadian Dental Care Plan, a $13 billion insurance program that'll start covering some of the more basic dentistry costs next year for uninsured Canadians with a household income under $90,000. We want to get into this. We want to make sure that everybody understands it as clearly as we need to. And so we're grateful that the VP of the Alberta Dental Association, Dr. Jenny Doerksen, has made time for us this morning. Doctor, welcome to the show. Thanks for making time for us.
Thank you, Ryan. Thank you for having me today.
Of course, this is a big announcement out of Ottawa for a lot of Canadians that, quite frankly, when money has been an issue, dental care is one of the things that they've just had to forego. It just hasn't been something that they've been able to fund for themselves. Where was your head at when you heard the announcement on Monday?
Yeah, this is a historic investment and milestone for a lot of Canadians out there. I would say 1/3 of Canadians who do not have private dental insurance that has a bit of difficult struggles to have proper access to oral health. If this has been played and designed very well, this could be a game changer for a lot of Canadians to improve their oral health.
So this is basically, as we read earlier, initially it's going to be for uninsured Canadians with a household income under $90,000, and applications will first be open to eligible seniors aged 87 and older. So that's a very specific demographic. And then, of course, the ages will drop down and applications will open up. They'll be phased in with a staggered approach. So I would imagine that this is the type of thing you're going to be wanting to tell people, don't cancel your existing dental insurance right now. What do people need to know? How should people be responding to this news?
Yeah, great question, Ryan. So basically, there's a lot of uncertainty and unknown factors with this program. So I wouldn't recommend to cancel your existing dental program. We just don't know too much of a detail in terms of what kind of services will be covered, if there will be any co-pay, anything like that. So just hold on to your existing plans. See your regular dentist to follow up with your dental concerns.
Is this something where people are going to be, I don't know if we know the details on this or not, are people going to be able to stay with their existing dentist, or are there going to be specific dentists that are funded by this? Do you know how that's going to go?
Yeah, that's one of the big concerns that we brought up to the federal health, because we do respect that every patient has the right to choose and see the dentist they want to see and receive treatment. So we don't want this introduction of the new program to interfere with the existing relationship between the patients and dentists, as well as their existing current dental programs.
So the first seniors we know, even that joined the program, won't be able to start making claims for dental visits until May. And we'll get details, I think, on what exact coverage dates will look like and how they'll vary from different people. But this is a thing where, while the announcement is made, this often happens with government-funded programs, the announcement's been made, but for a lot of people, this isn't going to be a reality for quite some time.
Yeah, I would agree with you. I mean, the letter has sent out to the senior folks over the age of 87, I believe, and then the program doesn't really start till May of 2024.
So what for the average person is going, well, what am I, at the end of the day, what am I going to have to pay for dental care? I mean, there's some people that may not have seen a dentist for 20 years, quite frankly. Right. What would you tell these people that have that basic question?
So definitely we have some concerns with this existing current issues where financial is a big concern for people who are not able to receive or who are not able to see a regular dentist. And we're hoping with collaborating and discussing with the federal government in order to design this program so that it can be effectively and efficiently delivered to the people that would actually benefit from receiving dental care. So unfortunately, right now, we have a lot of unknowns. So Ryan, I don't really know what I would need to say to these patients, what will be covered or what level of care will be received for this.
Yeah, I mean, hey, sometimes it's just like we don't know yet, and I guess we're waiting to know. How have Alberta dentists been, like, consultations obviously so big in all of this, and I do happen to know that your association had put a framework together. I think it was called a proposed framework for the Canadian Dental Care Plan, which was dentists across Canada that worked on that and contributed to it. Are you satisfied with the level of consultation? Like, did Alberta dentists have a say in how this was put together and rolled out?
Yeah, I mean, we were informed about this plan about 2 years ago when
Right.
This was introduced to the public, and we've been reaching out to the federal health just to kind of collaborate with the ideas of concerns that we had. I mean, dentists are the experts of delivering the services, and we know what system works, and we know what functions, what policies, and what programs that would be effectively delivered to our patients. So we've been reaching out, we've been drafted that framework that you were talking about. Unfortunately, we weren't really at the table till basically the last moment. So I would say October, November was the moment we are actually able to sit down with federal ministers and health ministers to discuss about our concerns, and hopefully they were able to hear us out a bit more as the program rolls out.
What's this been like? How long have you been practicing, doctor?
So it's about over 10 years.
10 years. So you've got a good lay of the land. You got a good sense of it. I've always been kind of surprised that dental care has not been funded or treated the same as a lot of other healthcare. There's evidence obviously, number one, that dental care is important, obviously, for people's mouths. But also there's links to like dental care and heart disease. And there's links to all of the things that maybe the average person doesn't spend too much time thinking about. As a professional and as a practitioner, are you surprised that it's taken this long for there to be any meaningful progress on publicly funded dental care?
It is unfortunate to, get to know some cases where people are delaying procedures or delaying treatments because of the financial burden on their shoulder. However, dentists like to focus on educating and also focusing on preventative care. So we're hoping this will be a bit of first step to help with people who do not have a private dental care, so they can see the regular dentist on a basis that they can bring up their concerns and then fix their issues on a timely manner, so it doesn't become a bigger unnecessary health damages. Because you're right, Ryan. Because oral health is a part of the overall health.
Yeah, and I happen to know that there's a lot of people. I'm just even thinking about in my own life. I'm even thinking about myself, Doc, and I would like just even think sometimes, and I'm the worst. I haven't had my annual physical with my family doc for 3 years. My wife's grinding my gears on it, and she should be. She cares about me. My family doc left during COVID. He was one of those that left, and I've just kind of been like, I don't know, passively looking for another one. Would have had a tough time doing it. Same with my dentist. All of a sudden, I'm getting these friendly calls from them. I'm realizing I haven't even been in for a cleaning for a couple years. It's like, what am I doing? I'm looking in the mirror right now. Why am I putting all this stuff on the back burner knowing that these are going to be on, some of the professionals are going to be able to say to me, listen, you got an issue. We can see it here right now. I don't know. Maybe the average person maybe we haven't prioritized our health as much as we need to. What do you think?
Well, definitely a priority is a bit of a first step to understand and care about your oral health. But definitely we want to ensure that we want to focus on educating, because oral health is as part of your overall health. And we want to make sure, people have different needs. So we want to make sure this program has a certain purposes to help with people to achieve their optimal oral health.
Are you concerned about the impact that this might have on dentists? Like, I'm thinking like workload, administrative duties. What are the top concerns?
Yeah, like any other health sectors, we do as a dentistry suffers from staffing shortages. Dentistry is a very team-based industry where we do need a front-end staff, receptionist, assistant, hygienist, just all collaborating, working together. So having this new program implemented without too much of details outlined, it is a bit of a concern for us because we don't know how much of a workload or administration burden that will play in our daily work functions.
Doctor, before I let you get, you're at practice today. We should know you're working. I appreciate you stepping out to talk to us. Is there anything that we haven't touched on specifically relating to this announcement and this new dental care plan for Canadians? Is there something you want to make sure that people have on their radar as they're learning more about it?
Yeah, I think we should still patiently wait for the program to be unfolds. We need to understand what are the coverages for our patients, and we want to make sure that patients have that freedom to choose the dentist they like to see. We also ensure that they have easy enrollment registration process, reducing the minimum workload by reducing the amount of admission burden on our front end staff, because we do not want to have this mass amount of patients, but our providers are not able to provide the care because of the workload. So we want to have a good balance between the patients and the providers. We also want to respect the patients that already have existing private dental coverages. So we want to make sure there's no disruptions and these people are able to receive dental care, optimal high quality dental care from Alberta dentists to improve their oral health.
All right, good stuff. So people, I guess a lot of people, like when you say wait for more details and some people have to wait to apply. If you're 45, 50, 60 years old, you're going to be waiting longer than those that are 85, which is great. I say, let our elders go to the front of the line. It's probably the way it should be. But at the same time, that means that some people are going to be waiting to book their dental care, right? For a lot of people, they're probably going to wait to book their appointment.
I would strongly encourage, if you have some dental concerns, seek care now, because things can be prevented and things can be treated well. And because delaying the treatments can only create more complications during the process. And like we were discussing about, oral health is a part of the overall health. So having some kind of disease in your mouth can cause some other disease in our overall throughout the body. So definitely have some urgent concerns or some questions, issues, please see your regular dentist and address that before waiting for a plan that may not be suitable for your individual need.
Yeah, no, that's a really good point, Doctor. We appreciate you making yourself available today. Thanks for making time.
No problem. Thanks, Ryan.
Yep, you got it. That's Dr. Jenny Doerksen. She's VP for the Alberta Dental Association. Yeah. I'm not sure why I all of a sudden started like confessing that I haven't had an annual physical for 3 years and like haven't had a dental checkup, but that's the truth.
As you were saying it, I'm the same way.
Really?
So I have the same thing my doc left during COVID.
Yeah.
Now I have a new doc who I have seen, but I really should go see him again. And then dentists as well. I think I've been like a year and a half ago. You're supposed to go like once
a couple times a year.
Oh my gosh, my wife goes like 2-3 times a year.
Like
she
that.
loves the feeling of those clean teeth.
Great when
right?
It's done.
It's amazing.
You know.
But I was just reading up. You know, like 80% of people have gingivitis, or will have it sometime in their life. 80% of the population, and that's in North America. So, I mean, almost everyone's going to get some form of gum disease at some time. And a lot of us just put it off, and that stuff can really start affecting the rest of your body.
Yeah. I had someone close to me in my life the other day call me to the carpet. They said, "How often do you floss?" And I was like, "Wow." I'm like, "I don't know." Like, you sort of like are trying to like blow off the question. Well, I mean, what do you mean? I mean, how often? How often? Who knows how often? And she was like, "No, like, how often do you floss?" And I was like, "Not very often." But we know we should. I
got the floss picks now.
Oh yeah,
because they're easier. Okay. So they're like the little
green or purple things.
Yeah,
I have some in my car. They're good. You're stuck in traffic.
Apparently, they're not as good as actually flossing, but they're quicker.
Better
and
than
easier.
nothing. I bet
they're quicker and easier for me before bed. Right.
So here are some of the services covered under the Canadian Dental Care Plan. So if you're wondering about this, like preventative services, like Johnny's just talking about, this is courtesy of the reporting of the CBC. The Canadian Dental Care Plan will include preventative services, scaling, cleaning, polishing, sealants, and fluoride. So that's kind of the standard stuff you'd expect. Diagnostic services, exams, and X-rays. That's a big one. A lot of times you go to the dentist and they'll go, a doctor wants to get an X-ray. Yeah. And you go, oh boy. All you hear is ching, 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 right? Yeah. But obviously, if you think you need one, you need one. Restorative services, fillings, crowns, and dentures, which is going to be huge for some people. Endodontic services, root canal treatments. Like, somebody, I mean, we talked about people that are delaying hip replacements, knee replacements. If you're waiting on major dental care, you are in a world of hurt right now as well. You already know that.
Really?
Complete partial removable dentures, prosthodontic services, periodontal services, deep scaling, and the oral surgeries, including extractions. Some of these services available in the fall of 24. Others will not be covered under the plan. Other services like teeth whitening, implants, and mouth guards.
Damn.
So you'll still be on the hook.
I want all three of those.
Johnny was hoping for a grill.
Kimberly in the chat.
If they're covering grills, can I get mine in 10 karat or 24 karat gold?
Kimberly in the chat says, goal for the day. Gonna floss my teeth.
Hey, you know what?
Because a lot of people forget, and then you're like, I haven't in like 2 weeks.
Why don't we all floss our teeth today? Why don't we all resolve to floss our teeth today?
Do you want to do it on the show right now?
No. Just there's no flattering or cool way to floss your teeth. So, by the way, on the income side as well, because I know people are interested on this. If your household income is below $70,000 annually, you will not be on the hook for any cost. If your household income is between $70,000 to $80,000, you'll have 60% of your fees covered.
That's pretty good.
The copay jumps to 60%. In other words, Ottawa will cover 40% of your tab if you're making between $80,000 and $90,000, and then if you're making over $90,000, then you're not eligible at this point. But that's good to have the families. I mean, for sure. And that's not to say like these days, let's be honest, nobody's rich. Families that are making $90,000 annually, that are paying today's housing costs, today's grocery costs, fuel costs. But you're making, if you're at $90,000, you're at least in a very different scenario than families that are making $45,000.
And you probably have substantial health care somewhere with your work or something like that, right?
And that's another good point. I'm glad you brought that up. People are saying don't jump right now to cancel your existing insurance
no.
until you get a sense of, you know how that goes, right? You cancel your dental insurance. the new plan hasn't kicked in, and then you take a puck in the teeth at the ODR, and then
the Real Talk Pond Hockey Classic.
The Real Talk Pond Hockey Classic. Yeah, that's right. Everybody should wear cages at the Real Talk Pond Hockey Classic. I want to get to a letter in just a second that a Real Talker sent us that just knocked me back yesterday, and it's a wonderful one. The subject line: "Life comes at you fast, especially in dog years," from Jared. I'm going to read that in just a second. You're going to see once I start reading it why I thought you might want to hear it, Real Talkers. But before we do, we've got a message from some of our friends, including those at Kubi Renewable Energy, that want to remind you, if you are looking for work right now, if you're a skilled and experienced electrician, you've got your ticket, or maybe you're an apprentice just looking to start your career, why not jump into the dynamic world of solar energy? The team at Kubi Renewable Energy isn't just building solar systems, they're cultivating the next generation of solar experts. They've got a fast-paced work environment powered by experienced professionals that love sharing their wisdom. They're keeners in the best way, and they're expanding their family across Edmonton, Calgary, Kamloops, and heads up, Lethbridge. They're looking for project managers, electricians, technologists, professional engineers, administrative professionals, and a whole lot more. So there's a ton of opportunity here. You can enjoy the rewarding journey, mentorship, limitless snacks, Johnny, and well-deserved office beers at the end of the day. Kubi is where expertise meets opportunity. Embrace the future of clean energy by checking out the careers link at kubienergy.ca. If you're looking, and I'm giving you Christmas gift ideas right now, you've got that person in your life, your spouse, your parents, whoever it is. Maybe it's your next door neighbor, I don't know, and they're looking to bring an outdoor space to life. It could be a small project like a fence replacement or a retaining wall, or it could be something major like a huge water project install, excavation. You're going to put in a new stone patio, whatever it is. What a cool gift to set up a meeting, a design consultation with the team at Eden Landscaping. They offer full project management from start to finish, and they're expert listeners. The way that they approach design, I've never seen anybody else do it. They can understand where your head's at. They take a look at your Pinterest boards and the things you've ripped out of magazines, and then they put in their personal touch. Have you thought about this? Have you considered this? The philosophy is that your exceptional landscape's got to be a thoughtful, flowing vision. You can start that conversation today with Eden Landscaping by checking out landscapeedmonton.ca.
Wow. Tracy says she's invested $16,000 in root canals in her mouth, so she's flossing every day.
Oh, my gosh.
We're going to floss as soon as we get off the show today.
Yeah, well, I mean, I do have those like little thingamajiggies in my bag.
Of course, so do I.
I'm just such an old timer, man. I roll around and I have a little plastic baggie in my work bag that I come in with every day, and it's got some Tums. And it's got a couple of those flossy things.
Couple Advil. Yeah, I know.
Maybe a Band-Aid, you know. So we get a lot of emails about politics, and we get a lot of emails about things that happen in the news cycle. But every once in a while, we get an email from somebody that's just about real life. And we got this one from Jared on Tuesday. He says, Jespo, I understand if you can't read this on air, as I know it will hit close to home. I said, yeah, right. I'm reading this from Jared. He says, I think of the reminders that I've gained over the past number of hours, he says, and I think that they're worth thinking about and sharing. And he says, and I know that you're going to be walking a similar road that I am eventually with your dogs, Moses and Monroe. We have Moses, who's 11 and a half. He's a boxer. Monroe is our beautiful black lab. And he says, I've finished crying enough to begin writing this message. This from Jared, a real talker. He says, I lost my second dog, my dog Augie, very suddenly and unexpectedly tonight. He's writing this at 11:30 at night. He says, Augie was 8.5 years old, a beautiful Rottie Shepherd mix. My first dog, Lilu, and you're seeing them both. If you're watching on YouTube right now, you're seeing both of them. So that's Lilu, the beautiful boxer, and then you've got Augie, who is a Rottie Shepherd mix. He says, we had to put down Lilu, our boxer, in 2019. I've been down this road once before, but it's not any easier the second time around. He says, today was a normal Tuesday until it wasn't. Augie joined me as I walked my daughter to and from school with my two young boys. He was lively and animated. By the time my wife got home, he showed no interest, though, in his evening walk, and by the end of the supper, he was lethargic. He had pale gums and he was struggling to climb the stairs. Fearing the worst, my wife and I had a quick conversation. We explained what we thought might be happening to our kids. We let everybody say their goodbyes, and I rushed him to the vet. And it was there that I learned that he had a 6.5 centimeter tumor on his spleen that was bleeding internally. Surgical intervention and blood transfusion was possible, but the potential for the tumor having metastasized or metastasizing later led to a very bleak post-op picture. They said it could be a 4-month life after that. Suffice it to say that euthanasia was the decision that my wife and I ultimately made for our dear Augie. Now, I could very easily choose to be mad about any number of things. The sudden loss of a close companion who's been with me throughout my journey through fatherhood, the grief that my family and children are experiencing, or the giant bucket of money I spent on Augie's last dental cleaning last month. So Augie's getting dental care even when we aren't.
They gotta.
He says, but I'm choosing to instead focus on the lessons that Augie is teaching me tonight. He says, number one, life comes at you fast, especially in dog years. You never know what's around the next bend. Give those you love a hug. Tell them you love them. Spend time with them. Foster those relationships. I was blessed to have the time and the space to make sure that everybody could say goodbye to Augie and to have spent regular time with him, our daily walks. But this can play out differently with people that we care about. The sudden death of a sibling or a friend, a parent, or a grandparent. Number two, he says, grief and shit happens. You can't insulate yourself from it, nor can you insulate your kids. What I do know is I can show them how to grieve healthily. It's okay for dad to cry. It's okay for Jespo to cry reading dad's email. It's okay to be sad. It's okay to learn how to pick up the pieces and move on while honoring their memory and the memory of what you've lost. One day, your kids will face grief again. We all will. A lost job, a health diagnosis, the loss of a loved one, and they'll need to know how to grieve. So my planned weekly grocery shopping trip is out the window. I'm staying home with my kids tomorrow morning, and I will play and love and grieve and laugh and cry. And number three, seasons are an immutable truth. You are young, then middle-aged, then old, and then you die. Life is short, but there are adventures around every corner and tons of mischief to be had. Chase rabbits through the fields, rip apart chew toys, take long naps, bark at planes in the sky while you can. I'm heading into a new season now, writes Jared, without any pets and with 3 young children in tow. Camping, long road trips, and all kinds of wonderful adventures will now be easier with Augie gone. Augie was a phenomenal dog and saved my ass from getting jumped by a pack of coyotes during COVID. But he wanted to chase rabbits and people on bikes and coyotes, which didn't make him the best vacation companion. He says, I'll miss having a third set of eyes around to help watch my kids. I'll miss my daily exercise partner who never failed to hold me accountable. But I'll be forever grateful for the memories and the lessons that Augie continues to give me. He says, keep it real, Jespo. That from Jared. Whew. I love it. Yeah. I'm so sad and sorry for Jared's family that they lost Augie and Lilu before. But how amazing the night of his passing, to think of his fellow Real Talkers, to think of the general public and the lessons he's learning, and to choose to share those lessons with us.
The innocent pets are always the hardest. We've got a pet going in today. She's a 14-year-old cat, and that's kind of getting up there around, the end of their lifespan, and she's getting a test today that'll tell us, whether her kidneys are in good shape, because usually kidney failure is like one of the main causes of cats passing away, and it's so hard because now we turn around and our lives are like, okay, this could be her last Christmas. We've got to change our lives. We've got to make everything about her, but like we really should be doing that. I mean, I know we can't every day, but like for a cat, for a dog, a day is like a week.
Yeah.
Yeah,
it's
a day
so true.
is a week. That's why every second, every pet, every hour to them is so important. So thinking about Supriya today as well. I saw her tweet.
Yeah.
Just something that really, I got it right here if you want to see it.
Yeah, Johnny, why don't you put that up? I appreciate that. It was a Noop day just the other day. Her husband, may he rest in peace, would have turned 41.
Yeah, but just another reason to like as our email was saying, live every day to its fullest, because we are going through our seasons. But for his 40th, she says, we talked about going to Hawaii with our kid, but he wanted to wait until the scans were clean. Of course, he passed away from cancer. Today would have been his 41st. This is from December 11th. And I'm spreading his ashes off the coast of Oahu. Don't wait. Take that trip. Life is too fucking short. And I read that the other morning and started crying and just thought, sometimes you get caught up in work and life. And like I said, with the cat today, and then all of a sudden you forget and you go hard and think, I got to put 100% into life again, when really we should be trying to do that at least a little bit every day, right? So
yeah, it's resonating with a lot of people in the chat. I knew that it would. Lauren says, what a great email. Our pets teach us such great lessons. Alberta Girl says puppies are a great way to grieve. Totally. If the time is right, definitely. Others of you are just saying, Leslie says that was so lovely. Take care, Jared and family. Says, we are to face the same situation with our elderly dog, and we're enjoying every moment with her. This is landing heavy with me. Yeah, Moses is, we're so grateful that we have Moses with us this Christmas.
He's strong.
We didn't
He's
think we were
kicking
going
it.
to, but he's
hanging around.
If you follow us on Instagram, in particular, if you follow my wife, Carrie Skelton, you've seen Moses's journey. Yeah. And we thought that Moses was going to be leaving us a couple of months ago, but he has refused. He's the most stubborn dog you'll ever meet in your life. Carrie has always said that Moses is the dog version of me. And that's kind of true. And so we, every single second that we have with him, he needed to go outside today at 3:45 in the morning, and I was up. Like, let's go. Because I'm going to wake up for 3:45s weeks and months and years from now, and there will be no Moses there, and I would give anything to get up and put on my coat and go outside with him,
My partner's a big believer in that too. When I come home and I don't say hello to the pets, she's on me. She's like, take 1 minute, take 2 minutes, look them in the eye, say hello to them, pick them up, hug them. Like, don't run into the shower, don't get into your comfy clothes, don't watch TV. Like, spend a few moments, because they've been waiting all day for this 5 minutes with you when you get home, right?
It's so true. It's so true. I love this. Tara Lynn says, I send my adult children a heart emoji every single night on their phones, and sometimes they roll their eyes at me, but my friend suddenly lost her child this fall, and I vowed to never stop making sure that they know that I love them every damn day. That from Tara Lynn. I absolutely love that. I like this from Kimberly, who says, I think of Supriya often. Tony's wondering if Supriya and I will get back to doing our Seriously podcast. The honest answer, Tony, is we don't know. I hope so, but Supriya right now is just where she needs to be with her daughter. And
she knows we all love her.
She knows we love her, and we check in with her often. And I sure hope that we can do it again down the line. But, of course, we're not putting any pressure on her at all. This is, everybody's talking about their pets here this morning. I love it. So this is just a great perspective check, and I'm just so grateful that Jared shared that with us. Also wanted to just say a quick thank you to Donna and Tony in our super chat this morning. Notice both of you kicking into our coffee fund.
Ken.
And Ken as well. Oh, I missed that. The chat's been booming lately, so it goes fast. It's like a stock ticker in front of me. But so Ken and Donna and Tony, we just wanted to say thank you for that. That we're doing this independently, and the ways that you support us. Many of you support us on Patreon. You can support us in the super chat, and a lot of you support us just by supporting our sponsors and letting them know that that's why you're supporting them. That's huge for us, and we're so grateful. That includes the family-owned business that's been around since 1955, if you can believe it. That's Friesen Brothers in 16 different Alberta communities. And if you go to their website, friesen.com right now, that's FRESON.com, you'll see all of the holiday stuff that they've got on offer, including Granny's holiday cake, Granny's Christmas cake. If you're into Christmas cakes, this one's going to blow your mind. Like, the recipe on it is absolutely fantastic. Granny Loveson's Bergenland Christmas cake. It's one of the add-ons that you can tack on to customize your Ukrainian-inspired Christmas dinner box. It comes with all the staples, so you're going to get, of course, the stuffing and the turkey and the pierogies and everything else prepared by their Red Seal chefs. But then you can add on a whole bunch of other wonderful stuff. You can order it online, or you can just head into your local Friesen Brothers for pickup. The best part about it, of course, you're available to socialize with your family and friends while the meal is already ready to go. You heat it up in the oven, And that's it.
And be sure, you can lie and say you made it. Who cares?
Yeah, just
say I've been slaving over it all day, guys. Here it is.
That was one of the things when Carrie and I first started dating. I went back in the day and picked up a couple of items and presented them on a plate. And this is when I knew I was going to love her. She's like, "Who made this?" And I was like, "What do you mean?" And I was going to lie to her face. I just decided to obfuscate. And I was like, "What do you mean?" She's like, "You didn't make this. You don't know how to make French onion soup." You can go to cateringbyfriesen.com to order your Ukrainian-inspired Christmas dinner box. And we want to give a big shout-out to our friends at Complete Care Restoration. This is the time of year where a lot of people are going to be gathering with friends and family at home. And the reality is that a lot of Albertans right now are not yet back in their homes because of the toll that this wildfire season took. The team at Complete Care Restoration is out there. I mean, they're out there still. December, January, February. They're rebuilding entire communities across the province of Alberta. It's what they're known for, and it's what they do better than anybody else. If disaster ever strikes in your neck of the woods, we want you to think of Complete Care Restoration first. Fire, flood damage, mold, asbestos removal, construction, renovation projects. They do it all. They're a team of talented professionals. We've seen them in action firsthand. You won't find anybody better in the business. You'll find them online at completecarerestoration.ca. Coming up on tomorrow's Real Talk, we're bringing back our friends from Alberta municipalities. Of course, we want to get a sense of where things are at this time of year politically at the most immediate level. Municipal politics affects us all every single day. So we'll have the new president of Alberta Municipalities, Mayor Tyler Gandam, joining us with two others. And Johnny, I forgot to tell you privately, so I'll tell you now on the show. It's going to be Ugly Christmas Sweater Day tomorrow on Real Talk. So
I'm ready.
See what you can do, pal. Me too. We can't wait. We'll see you then.
Real Talk is hosted by Ryan Jesperson, executive producer